All right, what up, y'all? It's your boy 1PTA, another day, another nursing home. Today's topic is, sore. I just lifted this dude, he's about 500 pounds. Today's topic is, no one ever thinks they're gonna end up in a nursing home. No one. I've been doing this for 15 years, probably worked at about, let's say 20 or 30 different nursing homes across the state of Maryland, across the state of Delaware. And I have never, in my years, never met one person out of tens of thousands probably of people. Never met one person who thought they would end up in a nursing home. Not one. And I'm talking about this today because I had two ladies today who were just biting my head off, asking me, when do I think they should go home? When do I think they'll be ready to go home? We get that question a lot as therapists who work in nursing homes. You think I'm ready to go home? When do you think I'll be ready to go home? Do you think I can go home soon? Like, sometimes people look at us as gatekeepers, and you know why? Because the buck gets passed a lot. A patient might ask the nursing staff, when do you think I can go home? You know what the nursing staff will tell them? You got to talk to therapy. A patient might ask the therapist, you know what the therapist will tell them? Well, we got to, check it over with your doctors and nursing and your family. So the buck is constantly passed. But typically in a nursing home, when a person's there for short-term rehab, they typically look at therapy as the gatekeepers, the ones who can bust them out of there. And two ladies today had like similar comments along the lines of, I don't belong in here with these people. Now, these ladies, both in here for falls, both up in age, I think late 70s, and they both have that thinking or that mentality as they don't belong in here with these people. Like, these people are different than them. Like, these people are other. These people are old and decrepit, and they vegetables, and they invalids, and whatever other name you want to call them. That's how they view these people. Not realizing that they are not far off from these people. They've been in multiple facilities, multiple falls. Let's just talk about one lady who's telling me that she does not belong in here with these people. This young lady doesn't want to get out of the bed hardly ever. She's in a nursing home for short-term rehab because she got weak. She was having falls at home. She wants to go back home, live alone, and do everything she was doing like she used to. And I get that term a lot. I was doing this and I was doing that. I was taking care of myself at home. I was. We get that a lot. I was doing this at home. I was walking all around the neighborhood at home. I wasn't using the walker at home. I wasn't using the cane. I didn't need any of that stuff at home. It's like past tense, and not realizing that things change, especially as we get older. Our health situations change. We might have a decline. You might have a UTI. You might have a fall, a broken hip or something, a fracture, a new knee, and then there's a slight decline. I'm not going to say it doesn't matter what you used to do. I'm not going to say that. But I am going to say you have to look at where you are now, not necessarily what you used to be. And I know that's the natural thing to talk about the things you used to do. I might reach a point where I might say, I used to be a therapist. I used to be able to lift 500-pound dudes. I used to be strong. Later on in the future, maybe 20, 30 years down the line, I might not be able to do that. I'm going to have to understand that, and I'm going to have to realize that I'm not what I used to be if I keep living. But yeah, these ladies, they were just kind of like criticizing other people in the nursing home, talking about they don't belong in here with these people. Let's take the lady number 2. She has 3 children who all believe she belongs in a nursing home. So she's mad at the children and trying to put me in the middle. I'm just so mad at my children. They get on my nerves. They keep telling me that I need to be in a nursing home. I'm like, well, why is that? Because I had a few falls at home. Well, how many falls did you have? Oh, about 8 last year. Okay, 8 falls. Yeah, and I had a UTI, and I was seeing things, and I was hallucinating and I was talking crazy and I was in a coma and I had to get IV and I had an infection. I had a couple of infections, like all of these things. And she wonders why her children believe she needs to be in a nursing home. And I didn't say this is the reason, but I just said, I can understand where your children are coming from, being somebody whose mother lives with him. My mother lives with me because I'm not going to say she lost her independence, but she was having a lot of issues at home and she needed more assistance. And I told her about my story, and I told her, it sounds like your story is similar to my mother's story, where your children believe you need more assistance. And her children are scattered throughout the country. I'm talking Florida, one's in Chicago, can't remember what the other one is. And they're communicating to her from a distance. And she lives with her grandchildren. She lives with 2 grandchildren. But the grandchildren also have jobs and lives. And she's having these falls and accidents and things when no one's there. This is why the children want her to be in a nursing home. But, of course, in her mind, I don't belong in here. I never thought I would be in here. Look at these people. I'm not one of them. Like, I'm not one of them. That's how some people talk. Not realizing, you might be one of them. You might be one of them and not realize it. Look, like I said, no one believes they're going to end up in a nursing home. No one. And no one wants to end up in a nursing home. However, there are thousands and thousands and thousands of nursing homes across the country with thousands and thousands and thousands of people in them. So, obviously, there's a need for them. And I guess it comes from our culture. Got to understand what our culture is here in America. Our culture is work, 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 hustle, take care of yourself, stay busy, always stay moving up, always stay moving forward, consumerism. And it's not necessarily built on strong family values and keeping the family together and generations living under the same roof like some cultures. That's just not our culture. Even though some of us do it. Like me personally, I got 3 generations in my house. I got a lot of friends whose parents live with them. It happens, but it's rare. It is rare. A lot of the times the kids don't want nothing to do with mom and dad. And I've seen this so many times. And this lady she's going through that. She's experiencing that. Kids don't want her to be by herself or with the grandchildren because the grandchildren have jobs and they have lives that they got to tend to. And they believe she needs to be in a nursing home, but she does not want to. So I see both sides. I told her I understand her side, and I told her I understand her children's side. So she just constantly hounding me. Just, when can I go home? I think I'm ready. I told her, I said, you got to talk that over with your loved ones because they are your powers of attorney. They should be on the same page with you as far as your plans moving forward. But this idea that you'll never end up in a nursing home, I wouldn't say that. I wouldn't say I'll never end up in a nursing home. I don't know. Anybody can have a stroke. You have a stroke, you lose complete function on one side of your body. I'm not sure your family or your loved ones are going to be prepared to handle that as far as your care. So nursing homes are necessary. So you can't say I'll never end up in a nursing home. You can say you don't want to, and you can take steps to prevent yourself from ending up in a nursing home, like living a healthier lifestyle. But I've met people in nursing homes who have lived healthy lifestyles. I've met 99-year-olds who've lost all of their family members. I'm talking no one's alive, but they're still living and need assistance. Nursing home is a good place for them. So, what's the moral of the story here? I don't know if there's no moral of the story, no lessons to be learned. Maybe the lesson of, you never know. You never know what might turn out for you. You never know. It's good to plan. No, maybe that's the lesson. The lesson is to plan. If you don't want to end up in a nursing home, make it a plan. Write it out. Put it in a trust. Put it in a will. Talk it over with your family members about that time. If you get to that point, what you want to do, what your wishes are. Now, you know what's funny? One of the ladies who I was talking about, she wants to get out of the nursing home, but she gets so short of breath, she can hardly walk 10 feet without getting short of breath. So when she does therapy, We got to take lots of breaks. She can hardly do much. And then as soon as I take her back to her room, the first thing she wants to do is lay down in bed. I'm like, ma'am, you're not going to get stronger if you spend the majority of your day in bed. But this is what I did at home. Okay, it's probably one of the reasons you're here. That type of lifestyle is what leads to long-term stay at a nursing home. So, moral of the story, man, plan for yourself. Live healthy. Try to do your best to stay active. Talk it over with your family about what you want to do in worst case scenarios, because anything can happen. So that's all I got for today. It was just interesting, man. Just these two ladies, they were like biting my head off about leaving and about the fact that they're not like these people in here. These people, like, these are people who didn't think they would be in a nursing home either. So yeah, fun day today at a nursing home. Always a lesson, always a story, always something that you can learn from. So all right, y'all, I'm gonna keep my eyes on the road. Oh no, matter of fact, I'm going to stop at this spot. These Middle Eastern dudes just moved in this tiny little town in Maryland, and they opened up this Go-Mart. Ooh, they got some good smoothies. I'm about to run in here and grab a mango smoothie. So I will holler at y'all in the next video. Y'all be cool. So good. So to wrap up, y'all, no one ever thinks they're going to end up in a nursing home. But don't be hating on people who live in nursing homes. These are some of the greatest of the greats. I done met business people, politicians. I had a mayor, millionaires. I haven't met a billionaire in a nursing home. Millionaires. I've met people who own 2,000-acre farms. I've met people who own 10 houses. I've met people who own many mansions. But they got to the point where they needed more assistance. So the nursing home was the best option for them. It happens sometimes. So don't discriminate and don't ever think you can't be that person. Y'all be cool.